Okay, the veterinarian can play an important role in colostrum management because the farmer will implement the colostrum management, will give the colostrum to the calves, but an important thing is to monitor that. And with Brix refractometers, for instance, it's quite easy to monitor both the colostrum quality and the serum IgG levels in the calves to see whether or not they receive sufficient amounts of antibodies. So an intelligent thing for vets could be that they perform sort of a follow-up on farms and check on calves to see whether or not they received sufficient amount of antibodies by Brix refractometry. So it's just a simple device. You take blood of a calf between 2 and 3 days of age, you put a drop of blood on the device, and then you can get an indirect measurement of the IgG content. And that would be good because then the vet can show to the farmer, look, you're doing a good job. All calves succeed in our test. Or look, apparently there's a problem because we have calves with failure of passive transfer, and then they can look upon what might be the reason and try and get the colostrum management better. A second thing is that if you do that for all calves, you know which calves are at risk, because those with failure of passive transfer have a higher risk of getting ill and dying even compared to other calves. And if you can already isolate these calves or give them a better treatment, that would be very beneficial for the overall results of the calf rearing on the farm. There are some vets who do that already, but it's not so that it's a habit on all farms. So as an advice to veterinarians, if they take that up on their farms and definitely on their problem farms, they will see that results will get better. And nowadays within Europe there's a tendency, or at least an advice, that you should use the lowest amount of antibiotics possible. Within that discussion, this is something that fits perfectly, because if you can let your calf start with a good neonatal immunity, you have a low risk of having a calf that gets sick, you have a lower need on antibiotics. So that is the first procedure to look upon in that whole discussion.